interaction that we have with women, and women understand women quite well. So I think that's where I started getting more and more interested, not just in the treatment part of it, but also in research, as well as education in breast cancer.
Right. And as we rightfully know, you have about 125 publications to your name.
That's right.
A great number, everyone. Please note that.
Well, that's a lifetime's work, I would say. So, yes.
Well, we're honored to have you on our show.
Thank you very much.
So ma'am, as we've already covered how you got into breast oncosurgery, could you also tell us a little bit about how you got into the other non-academic interests that you have?
The extracurricular.
The extracurriculars.
Absolutely.
Yes,
so I am an off-roader. I do off-roading, I do national level competition for off-roading, and I have also won a few prizes in those. In addition to that, I love driving, and I have been a co-driver to my daughter. I do the International Rally Championship, where I have co-driven my daughter, who's a rally driver, for 3 seasons. And we even had the podium finishes in a few of them. The top step, in fact.
Right.
And in addition to that, I love the long expedition drives. And the longest one that I have done is Kashmir to Kanyakumari, which is a 5,700 kilometers of drive.
Oh my God, that must have been one hell of a ride.
It was beautiful. It was beautiful because we were kind of tracing the whole length of India from north to south.
Right.
I've also been to the north face of Everest, driving through Tibet.
Oh my God.
Of course. Leh Ladakh you've already mentioned, so that's already there. So there are a few drives, and I love driving. That's my place where I really enjoy.
Right. So basically, you're breaking every stereotype that a doctor or especially a breast oncosurgeon has to be boring. Look at this cool lady over here, y'all. All right.
We really don't need stereotypes, do we?
No, we don't. You're absolutely right. All right. Moving on to the myths and facts now. Let's dive in straight to the myths and facts. Okay? You just have to tell me if it's a myth or a fact. All right? The first one. Breast cancer only happens to you if it runs in the family. Myth or fact?
Myth. Very frankly, because there are only 5 to 7% of breast cancers really are running in families. 95% of cases, it's other causes.
All right. So all the people out there who think कि अगर मेरी family में नहीं है, I am safe, that's a myth, right? Okay. So it's for you all. Next one. This is a quite unusual one. Wearing underwired bras can cause breast cancer. What do we think?
Myth.
Myth again?
Absolutely. In fact, there are lots of WhatsApp messages which keep going around talking about the underwired bras, talking about the color of the bras, black and red, causing breast cancer. There's absolutely no evidence to this. Please enjoy whatever color you like. Go ahead and wear it. I don't think it has any connection with developing a breast cancer.
Love that. All right, the next one. So they say that breast cancer only affects elderly women. What do we have to say, myth or fact?
Well, let me put it this way. It's a myth if you say only affects elderly women. But if you look at it, the incidence is higher in the elderly women everywhere because cancers are more common in older age. But in India, the incidence is highest at the age of 49. So we have more younger women being affected in India. And that's also because our population is much younger.
Right. So is there something like the screening should start as early as possible, or what age would you recommend the screening should start?
Right. So as I've said, the common age is 49 years, but we see as young as even 19 to 20 years. My youngest patient is about 19-year-old. So the recommended guidelines say that breast self-examination should start from the age of 25. Then when you cross the age of 35, you should also have a clinical breast examination. And screening with mammograms start at the age of 40 every year, and beyond the age of 50, it's every 2 years. So these are the recommended guidelines for breast cancer screening in India that's been put up by the ICMR.
The ICMR. to your mind which you would like to share?
Well, I can, yes. So I had a young woman around the age of 40. She had first presented to me with a small tumor, but very anxious. And she was very worried that she's going to lose her breast. One. Two, she was very worried because she's third thing that she was very worried about was her child. She had an 8-year-old boy, and she was very concerned as to how am I going to break the news to the boy, and how is he going to accept his mother if she was going to be receiving chemo and no hair. So that was a major concern. But fortunately for her, since the tumor was small, we were able to actually do a breast conservation and oncoplasty where the scars were not seen either. And although she did receive her chemo and she did lose her hair, I think she did kind of learn to cope and include the boy and her son in her treatment plans, and that made him much more accepting, as well as encouraging.
Her son took the news so well and they were able to cope with it well. Love that. Any other patient that comes to your mind? Similar young story, or somebody who is dealing with this and then was able to come out of it well?
Yeah. See, breaking the news of breast cancer is always something that one has to take care in how it's broken and how it's informed.
Right.
Because the first fear that you have when you hear about breast cancer is, am I going to live? Am I going to die?
Exactly.
And the main concern is not just for herself, it's for her child. In fact, more than the rest of the family, it's a child, she's always worried that, will my child make it without me? So, as I've said, early diagnosis is not always a death sentence. You can have a complete, fruitful life and live with a good quality of life as well. So I remember one story, this young patient, she was 32-year-old and had come to me in an extremely anxious state of mind. So I did explain to her that she had an early cancer, she didn't have anything to fear about, but still, she was just not opening. Next day, came back to me 4 days later. Nothing changed. You see, the best thing that we had was a patient now who was relaxed, more happy, accepting all that was being given to her, and she went through her treatment without anxiety. Right. Remember, anxiety can be a negative factor when it comes to outcomes in cancer. So you want the patient to be relaxed. You want the patient to accept the diagnosis, not deny. Right. The denial and the turmoil that goes in the mind is never good for outcome of treatment.
Right. And as you said, the anxiety part, the acceptance part, could you tell us a little bit about how the family or the caregivers or the people around the lady play a role in all of this?
Major role, I would say a major role. Because unless Fortunately, now in India, everybody understands and they do have a good support system for the patients. There are also NGOs who help us out in these. And I think the caregiving doesn't just go to the doctor alone. It's not just with us, but it's also with the family, the friends,
It takes a
support
team.
system, everything, and a good diet.
Right.
Nutrition and diet is also extremely important. And I think that's where the whole family has to come in together to take care of that one patient.
Beautiful. That's great. All right. So moving on to our next segment, let's talk a little bit about the future. So we've heard that you have been working with AI in breast cancer diagnostics. Could you please tell us a little bit? And we've also heard that you have publications about the same. If you could shed light on the same.
So AI, I think, has become the buzzword these days. You talk about anything, it's an AI. You open your phone and you look at it, you've got that meta there waiting to, answer your question. So you've got AI in every field.
Right.
Well, health is also another area where AI has got a major role. I personally have worked in the field of AI in diagnostics. Now, when I talk about diagnostics, it's the diagnosis of cancer and the prognostic information that you get out of a tumor. So breast cancer is not a one kind of cancer. You may have breast cancer patients, 4 of them. Each one of them has a different disease. And why is the disease different? Because the biology is different. The receptor status of the tumor is different. Now, all of these will dictate on how treatment is being done. And to understand this better, we have the slides that are available, tumor slides. If these are scanned, and there is a digital way of looking at these, the scanned images, and AI is then trained to actually give us outcomes.
Right. Like it helps you customize the treatment.
So I put this in very simple terms. It's much more complex than this.
Yeah.
I don't think that the complexity would be that clear. But essentially, you're looking at slide information, diagnostics to tell you what is the prognosis. Does the patient need to take intensive treatment like chemotherapy, or can they manage with simpler treatments like oral treatments? So there are answers like this that are hidden within the tumor biology.
Right.
And these can be deciphered using AI. Remember, humans train the AI. It's not the AI that controls
it's not the other way around.
Exactly.
Absolutely right. Correct. I think this AI treatment could be such a game changer for our field, and especially in the rural areas. What are your thoughts about it? Where we don't have as many trained doctors.
See, the reason why something like this has come in is primarily so that you can reduce the manpower requirement to do all the work.
Exactly.
There are 2 ways of looking at it. One person may bring up the fact that why do you need to reduce the manpower because you're reducing jobs. But I think it's just not that. It is finally you need the clinician, you need the pathologist, but you need something that speeds up the work.
Correct.
So AI is an accessory tool. Volume of work being taken care of.
Right. Understood. All right. So before we wrap up, I had a quick question. I'm sure a lot of people in our audience do too. How do these cancers and tumors relate to the professions of ladies these days? Like I know a lot of people have to compromise on their profession.
stage disease. She presented to us early, and our outcome is definitely going to be very good.
So early screening and early presenting is the key,
absolutely
right?
It's absolutely the right thing. She in fact only had a nipple discharge, so any change in the size of the breast, any nipple discharge, nipple retraction, recent ones, a lump that they're feeling, and especially so if it doesn't pain, it's very important to detect early and present for treatment early, and she did that.
Right. All right, Dr. Vani, one last question. It might be a little uncomfortable, but what about the delays? What if somebody presents later? And
there is as good as 95% chance of cure.
right.
Now that's something that one must remember, and this is if it is in stage 1, when the tumor is still less than 2 centimeter in size. Now obviously it's like, what is it that the first thing that the woman notices? Majority of the time, 85% of time, it's a lump.
Right.
And that lump would be painless.
And as we know, lumps don't lie.
Absolutely, you got that. So lumps don't lie is also my handle, and lumps don't lie is the term which clearly say that if you have a breast lump, even if it is not paining, it's painless. It's not bothering you other than being there. Don't ignore it, because that lump is telling you I'm not good. Because